She came in on a Tuesday morning, carrying a golden retriever named Biscuit, 9 years old, a little gray around the muzzle, and the kind of dog you meet once and think, that dog has had a good life. The owner, Carol, had him since he was 8 weeks old. She cooked for him. She kept every vet record in a binder. She was not a neglectful person. She was the opposite of a neglectful person. And she sat across from me in my exam room, genuinely confused, and said, "He just isn't himself anymore." He'd stopped greeting her at the door, stopped bringing her the tennis ball he'd carried around for 6 years. She'd put his food bowl down and he'd walk over, sniff it, and walk away. She'd assumed depression. Her previous vet had mentioned age-related cognitive decline. One person online told her it might be thyroid disease. None of them were wrong to consider those things, but none of them had looked in his mouth. I lifted Biscuit's lip on the left side, 4 fractured teeth, the kind of fractures you get from years of chewing on something too hard, and gum tissue so inflamed it had started pulling away from the roots. The smell alone told me this had been building for at least a year. When I pressed gently along his jaw, he flinched. Not dramatically. Just enough. The kind of flinch a dog gives when he's been hurting so long that he's stopped expecting relief. Carol didn't know. She had absolutely no idea. And that is the part that keeps me up at night. Not the damage itself, but how invisible it was. How long that dog had been suffering through every meal, every yawn, every time a child reached out to pet his face, and nobody saw it because dogs don't tell you where it hurts. They just change. I'm going to tell you what I wish every dog owner knew before they watch their dog quietly disappear into himself. By the time you finish watching this, you'll know exactly what to look for, what it means, and what you can do about it, starting tonight. Here's what most people don't understand about dental pain in dogs. It's not just about the teeth. The teeth are where it starts, but the damage spreads in a way that touches almost every system in the body, and that's why the symptoms look like something else entirely. Think about your dog's gums the way you'd think about the seal around a bathtub drain. When that seal is intact, everything stays contained. Water stays where it belongs. Nothing leaks into the walls. When the seal starts to crack, water seeps into places you can't see, and by the time you notice the damage, the problem has been going on for months. That's exactly what happens when gum disease takes hold. The tissue that's supposed to seal the base of each tooth starts breaking down, creating open pockets, actual pockets in the gum tissue, where bacteria collect and breed. Those bacteria don't stay in the mouth. That's the part your vet may not have had time to explain. Studies from veterinary research centers have found the same bacterial strains responsible for periodontal disease in dogs living inside the tissue of their hearts, kidneys, and livers. The mouth becomes a direct pipeline into the bloodstream, and the bloodstream carries that bacterial load everywhere. A dog with advanced periodontal disease isn't just dealing with tooth pain. The kidneys are filtering a higher bacterial burden. The heart valves, small, delicate structures that dogs are already prone to problems with as they age, are being bathed in inflammatory compounds day after day, and in the meantime, the dog is in pain. Constant, low-grade, grinding pain. Nothing acute enough to make him cry out. Just enough to change him, to make him not want to play, to make eating feel like punishment. To make the joy go out of him in a way that happens so gradually that by the time you notice, you've already decided it's just old age. It isn't old age. Old age doesn't cause pain. Disease causes pain. And this particular disease is one of the most preventable things I see in my clinic. I've spent 22 years doing this. I've operated inside the chests of dogs whose hearts were failing and held animals in the final moments of their lives. I've seen what happens inside a body when damage has been running silently for too long. And I'll tell you honestly, dental disease is one of the few things that never stops surprising me with how far it can go before anyone catches it. Not because owners don't care, they do, but because the signs don't look like mouth signs. They look like personality signs. They look like age. And nobody tells you to connect those two things until it's already serious. So let's talk about what you can actually do. what to look for, what it means, and how to act on it without waiting for your dog to show you obvious pain, because by the time the pain is obvious, you've already lost months. When you get home tonight, I want you to find a good light. Your phone flashlight works fine, and lift your dog's lip on both sides, not just the front teeth. Go all the way back to the molars. What you're looking for are 4 things, and any one of them warrants a call to your vet. Yellow or brown buildup along the gum line, gum tissue that looks red, swollen, or that seems to be pulling away from the base of the tooth, leaving a visible gap, teeth that look darker than the others or that have visible chips or cracks, and smell, because the smell of active periodontal disease is distinct. It's not just dog breath, it's a deep, almost sweet rot that hits you before your face is anywhere near the dog's mouth. I know some of you are reading that and thinking, my dog won't sit still for that. I hear that constantly. Here's what I tell those owners. A dog who truly won't let you look in their mouth is already telling you something. Healthy mouths don't usually hurt when you touch them. Resistance to oral examination is itself a symptom. Write that down. A 7-year-old beagle named Rudy came in last spring. His owner thought he was becoming aggressive in his old age. He'd snapped at 2 people in the past month, both times when they reached for his face. She was heartbroken, starting to wonder if he was safe around her grandchildren. I found a tooth root abscess, an infection that had formed at the base of a molar and was pressing against the bone of his jaw. Rudy wasn't aggressive. Rudy was in agony and doing the only thing he could to protect himself. After the tooth was extracted and he completed his antibiotics, he let every child at her Thanksgiving dinner pet his face. Same dog, different mouth. The second thing I want you to understand is what causes most of this damage, and it's not what you've been told to blame. Most owners assume dental disease is about genetics, or breed, or the luck of the draw. Genetics plays a role, yes. But the single biggest contributing factor I see, case after case, is this. Hard chewing objects. Bones, antlers, hooves, those compressed rawhide rolls. Things marketed specifically as dental chews that are actually dense enough to fracture a tooth. There's a rule I teach every new owner in my clinic. If you press your thumbnail into it and it doesn't give at all, it's too hard for your dog's teeth. Teeth can handle a certain amount of force. When you exceed that force repeatedly, the tooth cracks. Sometimes you can see the crack. More often, you can't. It runs below the gum line, into the root, and sits there collecting bacteria until the infection is serious enough to show up on an X-ray. A 10-year-old Labrador named Cooper had been given a knuckle bone every Friday night as a treat for years. His owner thought she was doing something good for him, keeping his teeth clean, giving him enrichment. By the time Cooper came to me, 3 of his upper carnassial teeth, the large shearing teeth in the back of the upper jaw, had slab fractures, where a chunk of the enamel had broken off in a flat piece like a slab of tile cracking away from a wall. 2 of those teeth needed extraction. 1 could be saved with a root canal. His owner cried in my office, not from blame, but from the specific grief of finding out that something you thought was helping was actually causing harm. She had no idea. Nobody had told her. After Cooper healed, she switched him to rubber chew toys rated for his size and a daily dental wipe routine. His checkup 6 months later showed no new damage. Now here is something that gets almost no attention, and I think about it every time I see a dog who's been written off as slowing down. The connection between mouth pain and food refusal. When a dog stops eating dry kibble, the instinct is to assume something is wrong with the stomach, the intestines, or the appetite center of the brain. It is almost never the first thing owners consider that the dog might simply be refusing to bite down because biting down hurts. I've had owners switch their dogs to wet food and report that their dog suddenly got his appetite back, and they attributed it to the taste. That dog didn't want a tastier meal. That dog needed a meal that didn't cause him pain to eat. If your dog has started leaving food in the bowl, especially dry food, or eating more slowly than usual, or dropping pieces of food after picking them up, please do not wait on that. Those are pain signals, not appetite signals, not boredom. pain. Have your vet look in that mouth before you try a new food brand. Engagement question, because I genuinely want to know, has your dog ever stopped eating a food they used to love and you couldn't figure out why? Tell me in the comments. I read every single one, and I'll respond to as many as I can. The fourth thing I want to address is home dental care. What actually works and what's mostly theater. You've probably seen the dental sprays, the water additives, the chews with the green stripe on the package. Some of those have real research behind them, most don't. The only home care method with consistent, repeatable veterinary research supporting it is toothbrushing. Specifically, brushing with an enzymatic toothpaste, one that contains glucose oxidase or lactoperoxidase, which are enzymes that break down the bacterial biofilm before it mineralizes into tartar. You cannot use human toothpaste. The fluoride concentration that's safe for humans is toxic if swallowed repeatedly by a dog, and dogs swallow everything. The brush itself matters less than the consistency. A finger brush, a soft pediatric toothbrush, even a piece of gauze wrapped around your finger. All of those work if you use them every day. Not 3 times a week. Not when you remember. Every day. Because the bacterial biofilm that causes periodontal disease starts reforming within 24 hours of being disrupted. You're not cleaning teeth. You're interrupting a cycle. And that cycle resets every single day. I'll be honest with you, most dogs tolerate this better than owners expect, especially if you start slowly. Day 1, just touch the outside of the teeth with your finger. Day 2, use something with the enzymatic toothpaste on it and let them taste it. Day 3, start moving in small circles along the gum line on the upper teeth. You don't need to open the mouth. The inside surfaces of the teeth stay cleaner on their own because the tongue moves across them constantly. It's the outer surfaces where the lip rests against the tooth that collect the most buildup. 2 minutes outer surfaces every night. That's it. And one more thing. Please don't skip the professional dental cleaning because you're afraid of anesthesia. I hear this every week. The fear of anesthesia in senior dogs is real. I understand it. But I need you to know what anesthesia-free dental cleaning actually is. It's a cosmetic procedure. A technician scaling visible tartar off the crown of the tooth while the dog is awake. It cannot safely reach below the gum line, which is where the actual disease lives. It cannot take dental x-rays, which is the only way to see root damage, bone loss, and abscesses. It makes the teeth look cleaner and the disease worse, because the owner feels reassured and delays real care. Modern veterinary anesthesia, with proper pre-anesthetic blood work and monitoring, carries far lower risk than most owners assume. The risk of untreated dental disease, to the kidneys, to the heart, to the dog's daily quality of life, is not small. Weigh those things honestly. Have you ever postponed a vet procedure because of anesthesia concerns? I'm not asking to judge anyone. I'm asking because I think there are a lot of dogs living in pain right now, because their owners are afraid of something that has become much safer than it used to be, and I'd like to help with that fear if I can. Tell me your concern in the comments. Every single thing I've walked you through today connects to the same underlying truth. Pain changes animals. It changes them quietly, over time, in ways that look like personality and age and temperament rather than medicine. The mouth is not separate from the rest of the dog. What happens in the gum tissue reaches the kidney. What happens at the tooth root changes the behavior. What happens during every meal shapes the dog's relationship with food, with people, with touch. Different doors, all leading to the same room. I went back to Carol and Biscuit 6 weeks after we extracted those 4 teeth and treated the gum disease. She sat in the same chair across from me, and I asked how he was doing. She pulled out her phone and showed me a video she'd taken that morning. Biscuit, carrying the tennis ball, dropping it at her feet, waiting. She said, "He brought me the ball. He hadn't done that in over a year." And then she said something I've heard in some version or another from dozens of owners after a dental procedure. She said, "Why didn't anyone tell me this sooner?" That question is part of why I make these videos. I can only see so many patients in a day. I can only explain so much in a 15-minute appointment. but I can tell you here, and you can carry it with you. So here's what I want you to take away. Look in that mouth tonight. Lift the lip, check the back teeth, notice the smell. Know that hard chewing objects are one of the leading causes of tooth fractures, and that the too hard rule is simple. If your thumbnail won't dent it, your dog's teeth shouldn't be on it. Understand that food refusal and behavior changes are pain signals before they are anything else. Start brushing with an enzymatic toothpaste if you haven't. Consistently, not occasionally. And do not delay professional dental care because of anesthesia fear. Talk to your vet honestly about the risks. They will almost always tell you that the risk of leaving disease untreated is greater. If all of that feels like too much at once, I want you to do just one thing. Pick one. Check the mouth tonight. Order the toothpaste. Call your vet and ask when a dental exam was last done. Just one thing. Start tonight. Your dog has been with you through everything. Every bad day, every quiet evening on the couch, every version of you that came home needing comfort. They did all of that while never telling you when something hurt. They deserve this. One small change. If someone in your life has a dog and you think they need to hear this, send them this video. That's all I ask. Everything I've shared today is general information based on current veterinary research and my clinical experience. It is not a replacement for your pet's individual veterinary care. Please talk to your vet before making changes to your dog's dental routine, especially if your pet has existing health conditions. Your vet is your partner in this. I'm just the person who wanted to make sure you had the conversation.